This is as of March 16th, 2020. Is the coronavirus or COVID-19 serious enough to realistically be concerned? I'm going to talk about that right now. Welcome back. My name is Ashley Osier and I am the posture specialist. If this is your first time and you would like to improve your posture, decrease pain, and enhance your overall wellness, make sure to subscribe and click that bell so that you can be notified when I upload my next video. If you have not heard about the coronavirus or COVID-19, you need to know about it. It started in Wuhan, China, and is a family of viruses. We want to be serious about this virus that's going around, who is at risk to get it, who has it, and how we can prevent it. So let's talk about how this works. COVID-19 is like a spiky ball, and the little spikes that are on the end of the ball, what they do is they go in to where your cell is, and on the outside of it, it masks itself so that your immune cells cannot identify them. Then what they do is they get into the cell nucleus and reproduce themselves in mass numbers, so much so that your immune system is just not simply able to defend itself. Some of the common signs include respiratory distress, respiratory symptoms, having a hard time taking a nice deep breath in. You might have a fever. A short, dry cough is signature to COVID-19. In severe cases, it goes into pneumonia, severe acute respiratory distress, kidney failure, and death. Before I get into the recommendations to prevent getting this and to protect yourself from people who may have it, I want to stress that if you do have symptoms, if you're not feeling well, if you're not sure if you have it, please stay in. Do not expose anybody to the potential of COVID-19. We don't know who is stressed, whose immune systems are compromised, who has chronic illness, and so I want to just really stress, please be responsible and kind and courteous to other people who may be having weakened immune systems, and they need the extra thoughtfulness of everybody that's in their community. Here are a number of things that we can do to prevent it and to protect ourselves from others who might have it. The Center of Disease Control highly recommends the following: stocking up on supplies, taking precautions to keep space between you and others. If you're in public, make sure to keep away from those who are sick, limit close contact, and wash your hands often. Avoid crowds. Also, the CDC encourages people to avoid cruise travel and non-essential air travel. If your community has an outbreak, please stay at home to decrease your exposure. The CDC recommends that you have enough supplies on hand. So, here is their list. You want to call your healthcare provider to get the extra medications that you might need in case there is an outbreak in your community and you need to be quarantined. If you're not able to go to a pharmacy, make sure to reach out to a mail order service so that they can bring them to you. I have a link that I will put down in the description box so that you guys can have access to that. You want to have tissues and over-the-counter basics for a fever. You want to have your sinus rinsing, cough medicines, etc. And I will have links for all of these for you down in the drop box below. You want to make sure that you have enough groceries and household essentials on hand. If you're not able to go out, you might have a grocery store in your area or some kind of a warehouse like Staples that you can order online. Walmart might be another option for you guys, or some other place that actually will ship things to you. Now, the CDC does say that most people are going to be able to recover at home. I cannot stress enough the following: clean your hands often, wash your hands often with soap for at least 20 seconds, especially after blowing your nose, coughing, sneezing, and being in public. The CDC suggests that if no soap is available, to use a hand sanitizer with at least 60% alcohol. Make sure to wear gloves or use a tissue if you're out in public and you're going to be touching doorknobs or elevator buttons, handrails, countertops, toilet seats or toilet handles, anything like that. The CDC highly recommends that you make sure to take those precautions, and especially try not to handshake. I know I actually just saw a program where public figures were having a hard time not handshaking because it's just so embedded in our habits to shake people's hands when we meet them. So really try and work on either having your hands in your pockets or holding your hands together when you meet somebody. And always make sure to wash your hands whenever you're in a public place. Try to keep those little hand sanitizers with you. Again, I will have links for all of these things for you guys so that you can grab them if you are not able to get to a grocery store or a supply store. Okay, moving on. Avoid touching your face, nose, eyes, and mouth. Clean and disinfect your home. And here's the list: tables, doorknobs, light switches, handles, toilets, faucets, sinks, cell phones, desks, You get the picture. So anywhere that you are kind of touching those doorknobs, light switches, anything like that where you're putting your hands, definitely make sure that you're wiping everything down. If you're in the kitchen, right, and you are washing dishes, right, the handles, the dishwasher, the stove, the refrigerator, the microwave, anything like that, make sure that you are wiping everything down. The CDC also recommends that you avoid crowds, especially in places where it is poorly ventilated. Avoid non-essential, and I would probably even say non-emergency travel. And that is by, for me, I would say by air, by boat, by subway, by train, anything like that where you are in a group of people. I would highly recommend that you just say no. Just say no, because it's not worth it. I don't know if you've heard the report, but there was a passenger who went on a plane after he had taken the test and got the results while he was in the air that he was positive. So you want to make sure that if you're getting a test for this, you need to not be in a crowd of people. You need to be at home, quarantining yourself and waiting until you get the results. If you're under the weather or if you're sick in any way, please do not put anybody at risk, because you could really, many people's lives could be at risk for you, just one person. And all you needed to have done is stayed at home for 2 weeks. So, you know, just really please, on the behalf of other people who are compromised, I highly recommend that you stay at home and wait until you are free and clear and ready to go. So the CDC does state that they want you to stay in and quarantine yourself if you have this in your community, if you actually have it yourself. And in particular, if you have it yourself, you want to make sure that you contact your healthcare provider ASAP. As soon as you start having symptoms, contact your physician. If you need to, contact an urgent care facility or an emergency and ask them whether or not you need to come in. Oftentimes they will have you come in like a side entrance. They have a special kind of designated area for people who are highly contagious. So take advantage of that. There are a number of doctors right now who are actually doing remote sessions via Zoom. And so it makes it that much easier, where all you need to do is contact your provider and they can set up a virtual appointment with you. So the CDC says to have a plan just in case you get sick. You want to have your healthcare provider handy. You want to make sure that you have your list of phone numbers of people who you can be in contact with. So you don't want to do this alone. You don't want to isolate yourself. Make sure that you're staying in contact with people, because if somebody needs to help you, you want to be able to have that quickly, okay? You don't want to have to be looking around when you are totally in distress. You want to have that easily accessible. And if you have a caregiver, you want to make sure to have a backup in case that person decides they're not going to be able to come and take care of you. You need to be able to have somebody else that can be a backup for you. And I'm going to have a link to an online caregiving service so that you can check them out. You will be able to find different providers, caregivers that can actually come to your home and care for you. So please make sure and check that out on what to do if you're sick, or if you're actually caring for somebody like an elderly parent, for example. I will have some additional resource information for you in the description box below, so make sure to check that link out. In addition to this video, I'm going to be having some follow-up videos. So if you want to be notified, make sure to click the bell after you've subscribed so that you can be notified when I upload those videos. Make sure to take really good care of yourselves. Stay healthy. Be thoughtful of those around you. Leave comments to let me know what's going on in your area. I know there's a lot going on in the world, and I'd love to hear what's going on in your area. So please make sure to leave comments. And until the next video, happy posturing.